Commissioner for Lands and Housing, and I'm also from Umunnochi local government.
All right, please tell us what is happening here today.
Today, we're all excited in Umunnochi that Our Excellency Dr. Alex Omooti flags off the Mbala Umuako Ngodo Road.
So how do you feel about today's event?
I'm excited. Umunnochi is at the center of the southeast, and the more you open up the roads, the more you open up the economy and connect the entire southeast. In ABIA State, no local government is left behind, as our governor has turned the entire state into a large construction zone. You can see that Umunnochi has not been left behind. ABIA State has been connected by developments taking place across the length and breadth of the state.
Alright, so please can you tell us the impact of this road?
Okay. The impact of this road is that His Excellency is connecting communities. 3 communities are connected: Ngodo, Umuako, and Mbala. It's also a road that connects to Anambra State, and also when the Imam Bridge is completed, it will also be a road that connects on to Enugu State. So we are opening up communities. By opening up this road, you have impacted on the land value, and you've also made it easier to evacuate agri-produce, etc. So the impact is economy and also connecting people.
I am Dr. Oluebube Amaruchechukwu, Senior Social Assistant to the Governor of Abia State on due process. I am from Umunnochi.
Alright, please tell us what is happening here today.
Right, His Excellency is here in Umunnochi today to flag off the construction of Ngodo Umuako Mbala Road. It's a very strategic arterial road in Umunnochi. It will contribute in evacuating agricultural produce, confer cities status on Umunnochi, and of course instigate all-round development for Umunnochi.
Alright, so how do you feel about what's happening?
I am beyond happy, I'm beyond joyful, I'm beyond excited, and I'm sure Umunnochi people are too for what is going on here. If you look around, it is a first. It is a first, and we are very, very grateful to the governor for the opportunity and for him fulfilling the promise of fixing this very, very strategic road.
The Executive Governor of Abia State, our own chairman, Abia State, the Governor, and the promise keeper. Your Excellency, here today, you're being received by the whole traditional rulers in Umunnochi local government area, with the chairs and all the government appointees. We are grateful, and that's why for me particularly I'm very excited, because I know that the average Umunnochi person value road construction. I am so grateful, because I don't have anything to do again is to come back to this road to make sure that we connect Umat and then connect Umat and then to Mbala. But here you are, taking off my shoulders and off the shoulders of those who are shying away to go and do roads. You have taken it off. Now that you have come to rescue us, we are very delighted that we didn't make a mistake to pray that God gave you the seat of Abia State, which He did.
Since the advent of democracy in Nigeria, 1999, this is the first time a sitting governor is coming to Umunnochi to flag off a road, an important road as Mbala, Umuako, Ngodo Road. We are grateful.
Abia State has been on the global map for the right reason. The administration of Governor Alex OTTI, OFR, inherited an agri sector that suffered decades of neglect and failed execution of programs and projects that would have helped the state to attain food sufficiency and security. To turn things around for good in the sector, the governor appointed Dr. Cliff Abezi, first as Special Advisor on Agriculture and later as Commissioner for Agriculture, replacing Professor Monica Ironkwe, who led the ministry before him. There are numerous achievements in the agricultural sector in the last 24 months of the people-centered and focused leadership of Governor Alex OTTI OFR. The highlights are: 1. The development of the agribusiness roadmap and strategic plans for Abia State's agri sector in line with His Excellency's vision. 2. 300 ABIANs were selected from the 184 wards and sponsored to the CSS Integrated Farms in Nasarawa State by the ABIA State Government to be trained and exposed to all forms of mechanized farming and the entire value chain of agriculture. The beneficiaries have been empowered with interest-free loans and provided with all needed support to set up their farms. 3. Successfully revoked and recovered the state plantations that were leased out under questionable conditions, set up interim ministerial management committee to run the rubber plantation and pending the result of the tender publication for new credible investors. 4. Signed MOU with Nimble Shore on the management of 10,000 hectares oil palm development project valued in excess of $120 million at Ukwa East. 5. Rolled out the statewide Farmers Enumeration Program to build a credible database on farmers and agriculture generally to have a dynamic agric map of the state. 6. 130 youths empowered along cassava and rice enterprises actively in their businesses with an average of 0.7 hectare of arable land in either cassava or rice, and also contributing to food security with a projected average yield of 2.5 tons per 0.7 hectare for rice and 17.5 tons per 0.7 hectare for cassava per cropping season. 7. Trained and supported 10 pilot beneficiaries on biogas as alternative source of energy. 8. Commenced the planting of rice on 150 hectares pilot rice cultivation program, currently expanded to 300 hectares at Owarinta. Mobilized about 1,000 hectares at Indio-Kabam for state's rice cluster in growers' rice farming scheme. Working with the ABIA State Open Multi-Purpose Cooperatives Society with a target production of 1 million bags of rice each planting yields, with a plan for sustained year-round planting and harvesting to achieve food security. 9. Currently setting up rice clusters in various communities in the state's rice belts of Arochukwu, Bendi, Ohafia and Isukwata local government areas. This is targeted at creating active farming cooperatives and clusters for our 8,500 hectares rice cultivation program. 10. Construction of 41 access and feeder roads in different communities, or CAPs, to ease the evacuation of agricultural produce from the farms to the markets. 11. Built toilets, ramps, and solar-powered boreholes wet markets in 34 communities. 12. Empowered 4,379 incubative beneficiaries along the agro-enterprise value chain of rice, cassava, poultry, and palm oil within 100 communities in participating 10 local government areas, and also in partnership with 141 incubators. 13. Established 34 school gardens in 34 primary schools across 34 communities. These and many more achievements have been recorded in the agric sector in the last 24 months, and various partnerships and investments are being explored for the mutual benefit of the state and interested investors. It is still early days in the agricultural value chain in Abia State, but the initiatives and programs are intentional and robust. The targets and outcomes are predefined with work plans to achieve them. Abia State has been on the global map in the last 24 months for the right reason.
My name is Kingsley Agomo, the General Manager, Umuahia Capital Development Authority. When we resumed, we met Umuahia Capital Development Authority in a very deplorable state. Nothing was working. The facilities were not there. The office environment was nothing to write home about. An office that the only computer could not even function, and then the staff dedication was not there. For me, and from most people, UCDA was just known as Ndenkoda, and that was the only CV. Everybody talks about UCDA. And then again, UCDA, that their mandate is to ensure that the physical development of the capital city, the physical planning matters are taken care of. The city was not looking like a capital city. The city was nothing to write home about. Umuahia was like a glorified local government. The facilities, every facility in this city was down and out. The Ishi Gate is like our Oshudi. Nothing works. The whole town was littered with potholes. The whole environment was not properly planned. The road network was not in good shape. The only thing you can use to identify Umuahia was everywhere was either motor park or a market. So the town was in a total bad shape. So what we did, from beginning, was the support and assistance of His Excellency, was to at least change the face of the office. We were able to, equip the office with computer gadgets. And then for today, we have over 6 computers in the office. And then we have another 6 to be installed any moment from now. And then what we did was to at least ensure that the data that we have is properly stored and secure. So all the building approvals before we came was all in hard copy. And then it was difficult to trace back or to even know how many approvals have been given within a period of time. So what we did in 2023 was to now scan and upload all the approvals that was issued in 2023 into our system. And then we went back to 2022, went back to 2021, and then going forward, we now said from 2024, every person coming for a building approval will come with a soft copy. So as we speak today, if you come with your building application, you will now come with a soft copy. So it's helped us to say within any space of time or within any period, this is the number of building approval that we've given. This number is for schools. This number is for hospitals. This number is for filling stations and other services. It also helps us in planning. And then it is easy for us, if somebody comes around, who can easily key in your name and know the state and page of the approval that has been given or your processing document has gotten to. This is something we've done, so far. And then again, we have also tried so much to decongest the city. Omaha is so crowded. Omaha is almost being choked up. So Atishi Gates is like a mad place. So what we did was to now send a submission and a proposal to His Excellency, so that we'll have the market relocated, to a new place. So we've gotten a location somewhere at Afara behind the Golden Guinea Breweries. And then the compensation has been paid. The fencing has commenced. The drawing of the market is ready. So we're going to have open shops and lock-up shops. And then any moment from now, hopefully early July, construction work will commence. And this will be a major milestone for the government through the support of His Excellency to give Umuahia a new face and a new life. Opened up the Library Avenue Road, which leads to the government house. This is something that we did from 2023. We've started engaging the managers on that stretch that operates on that Library Avenue. We engaged them in 2023 to get their buy-in, to get their support, so that within that period, we're able to now get them to demolish their fences, shift their ATM machine, and then that has enabled us to now expand that road to a 4-lane. So today, if you pass through the Library Avenue, coming through the boulevard, you can see a new face of Umuahia. You can see a new city moving towards the government house. And then that traffic we used to have around the FMC has been eliminated by this infrastructure. And then the street lighting on that road has also been improved. Not only on that library, but even on the Ibiam Road, the street that connects Rich Club through ABIA line, is also being worked upon, so that we have the entire space, and that's environment. Work is ongoing, and then hopefully within the few weeks, the work will be completed, well lit with solar lights. And that also will increase activities at night. Through the Ministry of Power, that the street lights within the city has been improved. Night activities has extended, Umuahia, and then that has increased the economic activity. People now stay beyond normal 7 o'clock. Before now, by 7 o'clock, Umuahia is shut down. But as you come out at 7, 8, 9, you see activities still on. Even at 10, you see people still moving around beyond 10, restoring the encroachment. Most people before the advent of this government, people have encroached into school lands. Government College, Umuahia, Big High School, Umopara, so many schools, people just went and then encroached into the school land. That of Government College, Umuahia, we've taken the bull by the horn. Most of the properties, especially their fences and some facilities, were pulled down, so that people will know that this is a school environment. It was so bad that people even demolished, iconic buildings within Government College Umuahia. So we are working with the old boys, and then and the Excellency has also given us the directive to ensure that all the lands that were encroached upon are recovered within the capital territory and returned back to the school. Within the office here, and then in the state, the state also approved a material testing laboratory. So equipment are being installed. It will be completed hopefully in the next 2 weeks. And the essence is to have every builder, either road construction, building properties, you have to bring your materials to the testing laboratory for the materials to be tested. be it electrical materials, plumbing materials. So all these things need to be tested, and then for us, it will reduce the incessant building collapse that we used to experience within the states, even though we've not been experiencing so much, but we want to nip it, at the board. And then we also intend to follow it up, not just testing it and then it ends there. We also follow up, come to the site to ensure that what was given to you is what you also use it. And then again, we are also working so hard to ensure that the recklessness of having parks all over the town reduced to the barest minimum. If you go through every street, it's a motor park. So the Ohia Park, we are trying to recover that park and then return it back to the former glory. Citizency has approved for compensation to be paid to those that built facilities in that place, because that place, the entire space has been defaced. So by the time we recover the space, all articulated vehicles along the Port Harcourt Enugu Highway around the tower, everybody will now be loading from the Ohia bus terminal. And then again, the state is also working to having a bus terminal within the former Gumabiri market. So that will also help to move every loading point to a particular location. And through our own submission, we are also working with the Nigerian Railways to now move their railway station within the bus terminal, so that you have the bus terminal and then you have the Nigerian Railway be co-located, so that passengers using the train can just disembark and then join the bus. And then those buses that are coming in from different parts of the state get to the bus site terminal, you come down and then join. So it's going to be very seamless and then makes transportation much, much easier for the Abians. So this is to give the city a new look. This is to give Umuahia a new character, take Umuahia away from the stress the city has gone through. And recently, His Excellency has also given an approval for a new Umuahia city to be developed. So, and we are working on that. And then the State Executive Council has also approved the Mbarakuma axis for the new Umuahia capital city. So the committee has been constituted, and then they will soon go into work, and it's being coordinated from this office and being headed by the General Manager UCDA. So much is going on, and the idea of the new city, old city is already overstretched. So we needed to move facilities and then the development towards that direction. That's not to say that the old city will be left unattended to. Two will move or grow almost at the same time. And then we also intend to have the development stretch towards Umudike axis, towards the Bende axis, towards the Ofeme axis. So it's going to be a development that will be completely all-encompassing. Say this is a new city, but ours is going to be a more comprehensive approach that we're going to apply. So much is going on in all areas. And then you can notice that within the city too, modern bus shelters that people can use. We're expecting that any moment from now, the electric buses will now start moving within the city. A lot is happening in Umuahia Capital Territory. And then we're also working towards removing unnecessary attachments that people put in their buildings. We have engaged the landlords, and then we have gotten their buy-in so that they will remove all the attachments. We have given them the specifications, we have given them the dimension that is 1.5 meters, so that every projection will not be more than 1.5. Having unnecessary projection and then attachments, we have given them a timeline, to remove those attachments. This is a government that has a human face to what we are doing. We always engage the people, we get their buy-in, and then we are so glad that the cooperation we have received from them, we cannot quantify it. All this we've been able to do within 2 years. And then I believe in the next 2 years, what Abians are going to experience, especially people that reside in the Capital Territory, a lot is going to come your way. This is just the beginning. You've not seen nothing yet. Thank you very much.
Dr. Betty Emeka Obasi, the Administrator, Abia State Eye Health Management Bureau. The Bureau was established in the month of July by the executive order of His Excellency Dr. Alex Shama OTTI in recognition of the critical role that the eye health plays in the broader spectrum of the public health. He is a health-loving governor that is responsive and the responsible government. Because, he's allotted 15% to health, and he declared the state of emergency when we started. So I had taken out time to go around the state, the 17 local government areas, and we had 19 hospitals there that had eye health facilities attached to them. And what we saw was a sorry sight, dilapidated structures, dilapidated facilities, We found disenchanted doctors. Doctors that had to go to work and there was no place for them to practice, yet they were in the system. Doctors that had to go to work and where they had to see patients, they had to go with their equipment to see patients, because we talked about 19 hospitals. I think about 14 of them didn't have equipment at all. We had just one, and that was the specialist hospital that had a place you could call a semi-clinic that was in operation. And what we did was take a report to His Excellency to say this is what the state of this is. And he said, give me a world-class eye center. And that was what we tried to do with the ABIA, the Diagnostic and Specialist Center on ABA Road. Talking about the ABA Road on its own, because I think we've taken a brief of going around the place, critical gaps to be filled in different hospitals where as it concerns the eye. And then in ABA Road, there was another sorry side. The space was just too small for the number of patients they had. Just a small number of patients. You found them sitting on the ground. They had been dehumanized, they had been debased, and then you see the doctors come to work. There's really nothing to do. You see them sitting around. We had almost 23 doctors. That's what we met in that place, eye doctors. Just how many rooms for them to practice? What was the equipment on ground? There was really almost nothing. What you had there was not up to standards. When he talked about this, of course, with the back end and support of the governor, we were able to go in there. We retrofitted the place, expanded the place, got enough space for patients to sit. Today, if you get in there, you're happy that you are, and the patients themselves, you respect them as people when they come, not because of what they are, because now I call the place a one-stop place. You have everybody can come in. It's standardized. The quality is where it should be. If you're very rich, you can come there. If you are one of those that we call the indigents, you can still come there. You get what you want. And at the same time, you come there, you come in the morning, you can get your glasses. We run the whole system in a go, and then you go home with your glasses. That's where we are with the clinic. I can boldly say that in the Southeast, we have about the best hospital that you can go to for when you have eye issues. And I can buttress this with just one little example. We had a guy that had gone blind in Port Harcourt, and he comes from Imo State. Of course, quacks had tampered with him, and then he had gone blind. His cornea had been burnt. I felt this was a case to be taken up. Let's go. We could go arrest whoever did this and all that. When I asked them, where do you come from? Where did this happen? In Port Harcourt. Where are you from? I'm from Imo State. So do you know what that means? It means they were referred from Port Harcourt, Imo, and they are in ABIA State. So it tells you the kind of structure we have put on ground there and the kind of equipment we have that can do it. So the minute we told him that he had gone blind, the cry was a cry of hopelessness, because where else would they go to? That was what it was. What we met on ground was them seeing 30 patients in a week. Monthly, that gives you an average of 120 patients they see. When we started off there, we now see in the minimum, we used to average 370 patients per week. Mathematically, that comes to about 1,400 plus every month. When you look at the IGI generated, I said prior to our taking our inception, the inception of this government, it was 500 to 600 that they have recorded, 1,000 that comes in as revenue generated. I said, when we took over, I said, from the very inception, we started, if you look at the average of what we do now, from there, we have taken it up to 15 million per month. That's about 2,900% increment in terms of revenue generation. You might want to look at it that if we're making so much, are we affordable? Yes, we are affordable. We are accessible, and we have standardized the place. That is what the Bureau is about. That is what this government is about as a Bureau, is to make sure that there is quality assurance, and then we're upgrading, upscaling, and retrofitting, renovating hospitals to cover to bridge the critical gaps that is in the. Every Friday as a matter is like a ritual. They are 8 o'clock to 9:30. We train. That's what we do. Ethics, everything you can think about, we train. So orientating the minds of the doctors we have, all the personnel, both medical and non-medical personnel. And so the difference here you see is you have people that understand what it means, be leaders to manage a place and to see patients. No longer business as usual, where patients come and they are treated like they are nobody. It does not matter who you are, as long as you are entering into a place where we run, you are treated like a customer, a patient, and with all the dignity that goes with you as a person. 1 out of every 5 that comes into the clinic when we started had glaucoma. and they didn't know they had. So that's where the public enlightenment comes into place. We've been everywhere talking about this and outreaches too, so that we can reach underserved people in the communities. So we come out to you. So what's this? The Abia State, we ensure that before His Excellency's tenure runs out, this first tenure, that if you live in Abia, you are a resident of Abia, you must have heard of eye doctors. You must have either come in contact with us by coming to the clinics, or you have heard us or through our public enlightenment or our outreaches, because we do outreaches supported by the governor 100%. We go to various communities, those that are underserved, to go to their localities to reach out to them. Tailored to people in their different communities. We do schools too. We've gone to different schools across the 3 senatorial zones, making sure that children, we are screening them. We have visual corridors given to them. When we build the visual corridor, for what we are saying to you is, you do not need to have a doctor come to you. We show them how it's done. There's a place you stand and you just self-examine yourself. If you know you can't see to this level, we have everything. I'm sure you should have a picture of one of our visual corridors we have in the schools. It's not even just restricted to the schools. We have in parks too, because drivers are of huge concern to us. The safety and all that is a big one for us in the bureau too. And then we have the latest device you use for cataract surgery. We have acquired it in Abia State. What it means is you do not have to go to the southwest. You do not have to go looking everywhere. You can just come to our specialist hospital. We begin to do surgeries with them. And then, of course, you are aware, when we talk about outreaches, recently we even had one where we went around the 17 local government areas, 3 different communities in each of the 17 local government areas. We saw patients training for glaucoma, giving glasses, giving drugs, all courtesy of the health-loving governor, harvesting cataract patients. And of course, you are aware that those patients have been operated on, and most of them, so it's like I can't see and I can see. It's a huge one, partnering with some of these organizations out there. So we have Obingwa, we have Ikwano, we have Ohafia, we have Okikwe, and then we have Arochukwu. What we have tried to do is what we have here in Abia Specialists, we have replicated in Aba, the Abia South now, and then we've gone to Arochukwu. The building is going on. We have acquired all the equipment we need to furnish. And so we're just waiting for the completion of that, and then we start off. So what it means is in each of the 3 senatorial zones, you have a diagnostic center, majorly, where you can operate on patients. They can be referred to, so that they do not have to refer them from Arochukwu or from Aba to the specialist in Abia. That is the kind of governor you have. He's responsive to the cries of Abians. I mean, especially when it comes to health, from where I'm speaking from, where I have a bias, the health sector. I like to see to Abia. You have hospitals now that have been upgraded and they are standardized. You have doctors that you can see, and if there are issues with your eyes, they can be detected on time. Where possible, prevention, we can help with preventing blindness, because some of these ailments like glaucoma, it's blindness that is irreversible, yet it is preventable. So we're saying to you, please avail yourself, bring yourself to the clinic so we can test, and you are sure at least once every year. Just step in there. The fact that you don't have like glaucoma today does not mean tomorrow it might not be there. So just come, let us tell you, you do not have these things. What we say is give you the certificate of no issues with your eyes. I mean, that's the easiest way I can put it. Next year again, we come, let us see you. And then because these things have been put in place, avail yourself those opportunities. Come to the clinic, get seen, get screened, and all that. And when we have outreaches, there's practically no locality we are not going to touch. When we get to your local, come out en masse and be a beneficiary of this great good work Alex OTTI's government is. Thank you.